pleasure to talk about this topic because I see a lot of women and men over 42, probably just like you. And I just turned 50. So I get it and I'm experiencing it right along with my patients right now. So you said give a little bit of background. I'll give you the quick version. So for me, I am a board certified obstetrician-gynecologist. I'm also a certified practitioner for the Institute for Functional Medicine. I have certification in bioidentical hormones. I'm board certified in obesity medicine. Now, how did I come to all of that? So it actually began 8th grade honors biology class, really cool, former veteran science teacher, Mr. Farouk. He made science so fun. When we got to life sciences, I just had an idea, Brad, like, wouldn't it be cool to deliver babies? So I took that thought all the way through medical school. Fast forward 2011, I'm a year out from having my second kid in a busy OB-GYN practice, supposed to be really living the life of my dream, but I was overworked. I was reaching in the cabinet for food, for comfort. I had gotten up to 240 pounds. And I knew I needed to do something professionally because I was stressed out on my job. And I needed to do something personally for my own health.
Yeah.
And so fast forward again, a couple of years, I lost 60 pounds. I also left that group and started my own practice. And that's when I started practicing weight loss initially because that was part of my personal journey. Then I learned about bioidentical hormones from my other patients who were telling me they were feeling amazing. And I realized that I'm an OB-GYN, but I really don't know anything about bioidentical hormones. So I went out and started studying that. So just like a lot of the people who listen to your podcast, I'm sure, I call those folks the true health seekers, and I was seeking for myself. That's how I got into these alternative worlds. Then I learned about functional medicine. Again, this is around 2016. I had never heard of it, but I understood it was about root causes, natural solutions. I was like, that's what I'm missing. And so now functional medicine is the umbrella under which I do everything else. So that's how I came to be from just a regular OB-GYN.
Yeah. Similar story for me, being the personal trainer and using theories that work for 20-year-olds and 30-year-olds. And then as you get to 40, even for myself, seeing that, oh man, it's not just pumping iron in the gym and a straight cut diet, perfect to get where you want. There's so many different things going on in the body, sleep, inflammation, and all that kind of stuff. So I've had to like completely rewire my thought process to help all my audience as well. So
if we talk about what is menopause, perimenopause, we can dive into that a little bit.
Yeah, I'm not the most fluent in that. And my wife right now is creeping up on the perimenopause. So selfishly, I need some education as well. But yeah, give us what you got.
Absolutely. So let's begin by defining menopause. So menopause is technically 1 year without a period, and the average age is 51. And so that's where we say a woman is menopausal. Now, if a woman does not have a uterus anymore, sometimes you go through menopause surgically when the ovaries are removed. So if someone has had a hysterectomy, but they still have their ovaries, they're still going to go through menopause at that average age of 51. Now, the time before you hit the full-on menopause, and that could begin in the 40s, that's what we call the perimenopause, which is around the menopause. And that's when the symptoms can start to kick in. So whether it's hot flashes, night sweat, vaginal dryness, mood swings, definitely the libido is probably crashing. That weight gain around the middle, Brad, which is probably why some of these women are starting to see you too. I have them come in and grab her and they go, I don't know where this came from. It wasn't here 18 months ago. Those are some of the things that we start to see in the perimenopause. And it can even go beyond what we typically associate with hormonal changes. So we will typically associate hot flashes, night sweats, things like that. But some of the things that you may not be thinking about, I've talked to women who you'll start having vision changes, by the way. I started wearing bifocals in my 40s because hormonal shifts. Some women are experiencing more aches and pains as their hormones are declining because a lot of times women don't know that your hormone estrogen plays a role in the lubrication of your joint. So it can play a role there. And definitely testosterone helps as far as muscle aches as well. Those are some of the other changes that you may note as you're going through the perimenopause. It can manifest itself in a lot of different ways.
Yeah. There's so many different symptoms, I mean, to everything in life, but specifically to menopause. I'm assuming every female is different on what they're going to go through. Is there anything linked to like genetics that they can see, like what were the symptoms that their parents or their grandma was going through? Or is it your environment or your food, or how do you know?
Yeah, Brad, I think it's a combination. When we think about the genetic side, we haven't like found a specific gene, but we do think about just sort of heredity. So I always would counsel a woman to talk to the older women in their lives to see how they experience menopause, because oftentimes their experience will be similar. So some women say, oh, my mother went through menopause and never had a hot flash or a night sweat. Maybe they will be fortunate enough to have that same experience. And then on the flip side, an older sister or a mother may have had a significant time, or maybe it took them a long time to finally end their period. So maybe they hit menopause at 54 or 55 instead of that average age of 50. So there is definitely something about the hereditary. We don't know what that specific gene is. And then to your point about environmental factors, for sure. So basic things like your diet, your hydration, those types of things can play a role. And what I tell people to watch out for, Brad, are what I call the menopause pretenders. And these are things that, especially let's say for your younger women, maybe they're in their late 30s and very early 40s, and they're having night sweats and they're trying to figure out, am I going through menopause? Well, I want them to take a look at the potential impact of what I call menopause pretenders. And one of those is alcohol. So if you have an alcohol at night, you're going to have swings in your blood sugar. That could bring on hot flashes. So it may not be that you're menopausal yet. And another one, which is sort of related, is actually sugar. So whether you're taking in something sweet or very carby at night or during the day, that can also impact night sweats and things like that, where you think you're going through menopause, but it's actually something environmental or diet related.
Yeah. How about some of the like dangerous symptoms that people need to watch out for? Like in my mind, I keep seeing this online and in life. Depression obviously can be a nasty thing, but is there anything else too that women need to really watch out for as they're going through peri to menopause?
Yeah, I don't know that there's any symptoms that I would call necessarily dangerous, but definitely monitoring your mood is going to be important. And when we get into our next segment, we'll talk about treatment and how some of those things can be balanced out with some hormone replacement therapy. I would say the other big thing to just make sure that women don't forget about, because this is a very busy time for a lot of women in this age. They've got young children. Sometimes they've got parents that are aging, and they oftentimes will put their own health on the back burner. So I would say being mindful to get your screening as far as your mammogram is concerned, mindful to get your colon cancer screening, because actually the recommendation now for most people is to start that at 45 versus 50. So just not forgetting your own health maintenance, I would say is one of the important things to be mindful of.
Yeah. And then, and like picking on the one thing I know my audience wants to know about the most, and we'll talk in the next segment of how to fix this, but just what is the science behind just more specifically the gaining weight? If someone's on a perfect calorie diet, someone's training, all this stuff, and yet they're still gaining weight around the midsections, in the personal trainer world, we're like, that is impossible. If everything else is going perfect, like what is going on in the body?
One of the things that I see that's going on in the body is what I call estrogen dominance. So both estrogen and progesterone decline as women are going through perimenopause and menopause. But progesterone is declining faster. So you, in essence, get estrogen dominance. And estrogen is a fat storing hormone. So when you're in that estrogen dominant state, you're going to be more likely to store fat. Another hormone that we often don't talk about that's not always just related to the perimenopause or menopause is cortisol. So many people are under stress. Cortisol is also a fat storing hormone. And something I would assume, Brad, that you address with your women too as they get older, maybe shifting their exercise, right, to more strength training and things like that versus just a lot of high cardio, which even that is potentially stressful on the body. So those are the other things that need to be addressed as well.
Yeah, I've talked about that on my show too, even for myself, just recently getting to the point where I was doing more cardio at night late, and now I'm suffering from insomnia. And then going through all my protocols and, oh, okay, that's probably not a good idea. Cutting that out. Oh my God, back to sleep. It's just, you can't do this stuff as you get older too late. Or if you do, you got to pick some of the lower cortisol producing movements that are not going to kill you like that.
Yeah, and it'll seem counterintuitive, especially for the people who love to exercise. But I had literally had patients where I had to tell them to reduce the intensity of their physical activity. And that's when weight started to drop off. So it really can happen that way.
Yeah. And that's why I talk about on my show all the time is how much better I feel and the same results of the body I want for cutting my workouts from 6 days a week to 3 or 4 and cutting from like an hour and a half down to an hour, down to like 30, 40 minutes sometimes. So it doesn't take much to get the results you need. And all that is based around that theory of high cortisol stress. Your body never gets a chance to recover. And man, those life lessons you learned the hard way. So
Yeah.
Dr. Woods, do you specifically work with females or also males as well?
Yeah, I see men and women. And so women go through menopause, and there is such a thing called andropause, where men are starting to lose their testosterone. I jokingly call it the grumpy old man syndrome. And with men, when their testosterone starts declining, and this is happening, Brad, I see it more and more in younger men. So
Yeah.
even again, 30s, 40s, we see men with declining testosterone levels, and they're going to be showing low energy. They're going to be showing lack of motivation. They're going to be showing belly fat as well, low libido, sometimes sexual dysfunction as far as maintaining erections and things like that. So their sleep can be disrupted. Testosterone has such a huge impact on the male body, as it does the woman. But yeah, you see all of those things in men.
Yeah. And why is that happening for some men that you're seeing that are in the 30s, young 40s, when it's supposed to happen later in life? Is there something going on in society that's causing all this, or?
Yeah, and I think it may be something that we haven't completely pinpointed, but definitely the environmental thing. So just think about, so many people are on what we call the SAD diet, the standard American diet.
Yeah.
That's going to play a role. The inflammation in the body, which partly is due to the bad diet, is going to play a role. The sedentary lifestyle is playing a role. The stress that they're under. So all of those factors together. And then as you're aging, the testes are producing less testosterone. So that is another factor as well.
Yeah. In my 20s and 30s, I remember begging my doctors to add in the testosterone because I always wanted to see it. And then as I got into my 30s, I saw the testosterone drop a lot. And my doctors would tell me, like, not everything is based on that number either, because I still feel sexually active. I still feel, good in the gym. So you can't go off that number. And then later I talked to some other experts and saying the overall testosterone plays a part, but you can't just go off that number. It's the
free testosterone and the bioavailable testosterone.
Yeah.
All those things play a role as well. Let me say this too about hormones. And I think this is true, Brad, for both men and women. From my functional medicine perspective, I'm always talking about optimization and not just being normal. And what I learned from my mentor is normal is not optimal, but optimal is best. And unfortunately, these standard normal ranges have a lot of sick people within the range. That's how I think about it. And with men and their testosterone levels, and I know some men are frustrated by it because I think the range is like 250 to 1,000, maybe 300 to 1,000, depending on the lab. And so if you're that man that's at like 299 and you've got low energy, low libido, and you go to your regular doctor and they go, your testosterone is normal, it's something else. But you would probably feel a lot better if it was over 500. And let me also share a particular research study that came out, because just to point out the fact that testosterone in men, it's not just about feeling good in libido. There are other factors involved. So there was a study of veterans and male veterans, and they divided them, men with testosterone levels below 500 and veteran men with testosterone levels above 500. For those men with testosterone levels below 500, the incidence of like any chronic disease you could think of, whether it's high blood pressure, diabetes, all of these things were higher in that lower testosterone group versus the upper. And so I always think that I want to see a man's testosterone level at least above 500, if not really at the top of the range, is what I try to shoot for, because that testosterone is affecting more than just libido. It's about really longevity overall.
Yeah. Hey, go back to my personal experiences. I've seen in my 30s, my testosterone get as low as like 250, but feeling great, everything in the gym, sexually active, like I was saying. I think my free
testosterone
was always decent. And I think that's what my doctors always said.
So that's what's saving you.
And then in my 40s, actually seeing both of those numbers come down. And one of the cool things I started doing after talking to a lot of different people, started intermittent fasting, and then every now and then some longer fasting, then feeling great and going and getting those levels checked and seeing both those numbers climb up. So
That's nice.
Yeah. So I've discovered, and I know it doesn't work for everybody, but I just know that it can happen. So, well, cool. Dr. Woods, let's go into the good stuff now for the second portion. What can we do to fix this? Obviously there's hormonal therapies. I don't know if you want to talk about that or not, or if you only do like the functional holistic. What can we do for both female and men to do the best we can?
Yeah. So I feel like the best way to tackle hormonal issues is to give the body back what it's missing. And so I do a lot of bioidentical hormone replacement therapy for men and women. So if we start with women, and it depends on where they are. So the first hormone that oftentimes I consider for women, especially when they're in that perimenopause, menopause, is progesterone. And progesterone, Brad, is what I call my secret weapon hormone because it has a couple of really great benefits. So a lot of women are having trouble sleeping, and a lot of women are noticing changes in their mood, feeling more anxious. And so progesterone, the two amazing benefits is that it has a natural sedative effect that can help you sleep at night, and it has a natural calming effect. So it helps with the mood. It really works on those GABA receptors in the brain, which are calming receptors. And so progesterone can be amazing for women in their 40s and beyond. They can avoid a sleeping pill. They can avoid sometimes antidepressants, anti-anxiety medications. Some people need that, but a lot of women just need their progesterone optimized. So that one is super important. The next one that I consider is testosterone. So first thing, I always want to debunk the myth that testosterone is only important for men. That is not true. It's important for women also. And also debunking the idea that testosterone is only about sexual function, which is not true. Now, definitely it can help with libido and it can help enhance orgasm, but testosterone also helps with energy, mental clarity, helps you build muscle mass over time so that you can start to burn fat more efficiently. So it's a little dial that you turn in your favor as far as your metabolism and other things. And then the last thing you add is estrogen, because that can still fluctuate a lot, especially for the perimenopausal women. And as I explained in the last segment, you don't want to put yourself in an estrogen dominant state. So you don't want to overprescribe estrogen. That's usually the last thing that you add.
Yeah. And all these things you're talking about, progesterone, testosterone, estrogen, are these pills? Are these injections? Are these just changes in their lifestyle? What are you prescribing on that
Yeah,
side?
absolutely. So they can come in different modalities, and I'll run through what I feel is least effective to most effective.
Perfect.
And these are prescriptions. They are bioidentical. And when I say bioidentical, I mean it has the same chemical structure as the hormones your body naturally produces. And so there's creams that you can apply every day. Not my favorite because it's messy. People absorb it differently. And with progesterone in particular, you cannot get a good blood level via a cream. And so it's not as effective. There are capsules that you can take, particularly of, say, estrogen or progesterone. There is something called a troche, which I like. It's like a little throat lozenge. It's like a little square wax-based preparation of hormone. You can put all the hormones in one. So it's super convenient in that way. There are injections that I offer in my office. You can do estrogen and testosterone there. We like to keep progesterone at night so you can get that sedative effect. And then there's something called a pellet. A pellet is a little compressed powder of hormone, like the size of a Tic Tac or smaller. It's a procedure that we do in the office, Brad. For women in the upper outer buttock area, we place that pellet in the fatty tissue. It's slowly absorbed over 3 to 4 months. For men, we can also do pellets as well. And for men, the pellet can last for about 6 months. So those are the ways in which you can give hormones.
So like for guys, the testosterone, in my mind, it's the injections into the glutes. Is that not a thing now, or just that's not the best way to go about it?
Yeah, injection is a great form, I think, as well. So I do have them either on injection, a few on troche, and then some on pellets as well.
Okay. Cool. And then also going into everyone's different, right? Of the need of whatever modality you have, and then versus people who are just barely experiencing these issues. It's not that bad. Maybe they don't need this hormonal therapy right now. Is there anything to change with the diet or any holistic stuff that you talk about with your clients that maybe they can start prior to maybe needing some of these more extreme things?
Yeah, absolutely. Now, I don't consider hormones extreme. I think it's all part of the process. And what we do, and this is where I say it's a comprehensive approach, because we definitely talk about diet and lifestyle. We're not just throwing out hormones and not talking to people about correcting these other things. So I usually recommend a paleo type diet. So it's no grains and no dairy for the most part. I also like to talk about, of course, physical activity, strength training, which is really important. We talk about the importance of sleep. We work on reducing inflammation. So there are a lot of different pillars that come into play. And for most people, just like you gave the example, Brad, you've got your other pillars dialed in, right? Your nutrition, your sleep, your exercise. If you have that dialed in, you have less of a need for hormone replacement. Whereas if you don't have those things dialed in, you may have more of a need. And as you mature, as I like to say, as you age, the need for different things will change as well. And I think that's where you find women in your clientele and the women that I meet, they come in sometimes and they are eating well and they are exercising and they're still stuck. And it is that they need some help with their hormones. And there are some natural things too, like herbals that can help in some ways, particularly with some of the symptoms, like whether it's chaste tree or whether it's yam. Those are some of the natural things. Dim, which also can be found in cruciferous vegetables, black cohosh. These are some of the herbs that can start to help a little bit when you're early on in your symptoms.
Yeah. I know personally for myself, I like the real low level biohacking, not trying too many things that are crazy and starting with the basics, like all the stuff you mentioned I'm doing.
Yes.
And I don't have a problem with Western medicine and some of the things are coming out. I think it's great. But my theory is last as long as you can, but I am not trying to suffer.
Yes.
So already in my head, in my 50s, 60s, I want the help because I know we can't live forever. We can't fix everything. It's
Right.
just part of the process. So the longer you
Absolutely.
can have an enjoyable life, for me as a male, that be able to retain some muscle and feel
Yes.
good into my 70s, 80s. So I have no problem with that. But in my mind, I'm trying to fight as hard as I can.
Yeah, and you got to do it. You can't do one without the other. Like, let me make that point. Like, hormone replacement is not going to be the fix for everything. You still have to get, like I said, your nutrition and your lifestyle dialed in. It is so important also. You really got to put together. And what I do, Brad, is really considered non-traditional. Like your
Yeah.
traditional OB-GYN is not going to be offering you testosterone. They're not going to be they're not going to be talking about that. So you really got to find like a hormone expert or a functional medicine doctor that does hormone replacement like I do.
Exactly. That's why I always like going to private practices and stuff like that, because they're stripped away from the corporate,
Yeah.
what they're allowed to do and do their own education and that stuff. And so I have a DPC here to do that kind of stuff. And then I still have my insurance because God forbid I get in a car wreck, my DPC is not going to help me.
Right. Right.
But for your practice, Dr. Woods, I know this is a problem with a lot of doctors that you can only operate in the state you're in. Is that the same thing with you? You can only take clients in Kansas. You can't help everyone across the 50 states?
So only in the states that I'm licensed in.
Oh,
I am licensed currently in Kansas, Missouri, and California.
Oh, cool.
So if anybody is a resident of those states, I can help them directly. And I do have a Facebook community where I provide free education as well, and that's open to anybody.
Yeah, very cool. I just talked to an allergist who had somehow gotten the ability to cover all 50 states. I thought that was insane. He said it took an act of God with lawyers and everything, but a system that worked, that was legal, that he could do that. But I was just like, that's what's needed. If you got a setup like that and you got the support, whatever it takes to do that, but to get this information out, if some person's got it, some expert, it just sucks that you can only go to that state. So
Yeah. And I am looking to expand that. And again, if you're educating, you can educate anybody. But if you're literally practicing medicine or prescribing, it has to be in the states that you're licensed in. So I'm looking to expand my reach so I can help more people.
Awesome. Dr. Woods, is there a typical age range for men and females where obviously there's younger and some go a little longer, but you mentioned females kind of 51 is that sweet spot. What's the age range for females and what's a typical age range for males that like really need your help?
Yeah. So women are usually coming to see me in their mid 40s when they're perimenopausal. That's when those symptoms start to really hit. So mid 40s all the way up to 60 is that usual age range where I'm helping people. And men, I'd say the same. It's 40 plus is when I start seeing men as well. That's when those hormones really start to shift. So it's almost the same.
Yeah. Okay, cool. Well, let's go more into, you were talking about more of the functional medicine aspect. What else you got in that category?
Yeah. So I think a lot of people may be new to the term functional medicine and what is that exactly? So, functional medicine, again, it's about natural solutions and root causes. And I like to give an analogy of picturing like an iceberg. If I'm making a comparison of functional medicine versus traditional medicine. Some people call traditional medicine conventional medicine. So if you look at what's above the surface, imagine you're looking at an iceberg. Above the surface is like your traditional medicine. They're asking the question, what? They're kind of surface level question, often needing a diagnosis or they can treat something in particular. And if they don't have a diagnosis, oftentimes they cannot treat. They're asking the question, what? Whereas you imagine what all is below the surface of that iceberg. First of all, most of it is below the surface.
Yeah.
Secondly, it goes very deep. And so that is the situation with functional medicine. We're asking the question, why? We're trying to dig a little bit deeper. And then to give you a real world example, let's think about gut health. How many people have reflux, indigestion? They all get a pill for that, right? They get the
Hmm.
purple pill, but no one asks, like, why do you have reflux or indigestion? Is it because you have not enough digestive enzymes? Is it because of certain foods that you're eating? Are you having an overgrowth of something further down in the GI tract? So we want to ask those questions and start to address what's actually missing versus just giving you something to cover up the symptoms at the surface level. That's really some of the distinction between functional medicine versus traditional medicine.
Yeah. And I've talked about that on my podcast for myself for the last 2 years, really just going
Mhm.
after inflammation,
Yes.
environmental allergies, food allergies,
Mhm.
bloating. I'm just
Yes.
sick of it, and
Yeah.
just started diving down that path and done wonders to fix that.
Mhm.
It's not perfect, which always
Yeah.
striving to get that system that works. But everything you just said, that's what we need to get to. And I know in the
Yes.
Western culture and in the corporations with all the big hospitals and everything, there are osteopaths, and I've talked to osteopaths before, and that's their jam. Is everything you said is we got to look at the root causes. But all of them still, the ones I talked to said they had to go out on their own, just because you work for any corporation, for any job, you can only go so far,
Mhm.
and you're told what
Right.
to do and what to learn and all that. You can't do it for yourself. So that's what I see. It just sucks that the insurance
Yeah.
world doesn't help us out on
Mhm.
that side. So
A couple of thoughts. So, and that's part of the reason why I wrote this book, Physician Unleashed. It's over my shoulder here. I wrote that with my physician friend, and we tell our journey of leaving the traditional medical world and starting independent practices and why we did it. The other thing, too, that I think about as far as for your listeners who are maybe considering seeing a functional medicine doctor or hormone specialist or anything of that nature, but they're like, but I have good insurance. We have people say that. I think about our health insurance like I think about car insurance, right? So your car insurance is going to pay for a wreck if you break your windshield, just like your health insurance pays, like you said, if you break a bone or if you need major surgery. But your car insurance does not pay for tune-ups and it doesn't pay for gas. And so your health insurance does not pay for these preventive things, these proactive things in a lot of areas. And that is something that you need to invest in for yourself. And let me tell you, I'm sure, Brad, with your own experience and the people that I talk to, that is an investment that they 9 times out of 10 are going to say it was well worth it.
yeah, I talk about it all the
Mhm.
time. You got to take your health into your
Mhm.
own hands and start caring,
Yes.
because it's not going to be done
Yes.
for you until it's too late.
Mhm.
That's the old way of
Yeah.
thinking. Funny, I just had a shoulder injury like 3 months ago, and knowing all this, and to go talk to my doctor is going to be $50. To get thrown into an X-ray because they won't do an MRI right away, that's $80.
Mhm.
Then I got to talk to a specialist. That's another 50 to $100. Then they finally give me the MRI, which is probably $200. Or I just go in and cash pay it and let my DPC doctor look at it. And that ended up being cheaper.
Right.
And I got it in 2 days' time when I needed it.
Yeah. And you've got to be your own advocate. I think that's important too. You got to be your own advocate and really go out there, which I think is important too. And I even think about one of the things that is important about what we do, and I think you probably do it too, is just helping people with their accountability. Because we
Yes.
all know we should eat better. We all know we should eat the junk, but sometimes you need a coach. So just like we pay for our kids to have coaches in their little league baseball and basketball, we need coaches for ourselves. I mean, because we're talking about potentially interventions that we could do, even if it's lifestyle changing. So I have a personal trainer that I see 3 days a week because I'm not a person that loves exercise. I need accountability and to know that somebody is waiting on me to show up. But I know I need that for myself. So I invested in that and I get it done. And so we need a coach sometimes to help us with our movement. We may need a coach to help us, or an advisor or a physician to help us with our wellness journey. And that's okay. And it's well worth the investment.
Yeah, exactly. I mean, preaching to the choir here. That's my whole main bread
Right.
and butter is accountability and motivation more than expertise on muscle building,
Mhm.
if anything. And I can tell
Right.
you, even coaches need coaches. So there's nothing wrong
Yes,
for me saying,
absolutely.
looking for help and all that kind of stuff. So
Yeah.
Well, very cool. Well, Dr. Woods, tell us, how does my audience, if they're any of those states that you mentioned, and also about your book, how can they find you? How can they find that book? What social media are you on?
Absolutely. So on Facebook, Dr. Woods Wellness, and then my private Facebook community, we've got like 3,500 women in that one. It's called The Natural Hormone Fix. And I go live in there almost every week, talking about functional medicine principles, hormone related things. And I am Malaika with MD on Instagram. My book is actually for physicians and practitioners. So telling them that journey, because I coach physicians and practitioners on starting independent practices also.
Oh, very cool. My audience knows I'll put all those links that you mentioned in the show notes if they just want to be able to click on it. But I think that's great what you're doing. And I love this independent movement that's going in the medical world. And I'm just seeing the better quality care, at least in my experience. I don't want to put that out there for everybody, but that's why I reached out more of the DPC concierge, but there's other organizations such as yourself, the allergist that I just had on my show, same thing. So take health into your own hands. That's my message. But yeah, I just want to thank you once again, Dr. Woods, for coming on my show. It's been a great talk.
Thank you for having me.